100 years ago, a disease swept the world and left thousands of people frozen, where they sat, awake, aware, and unable to move. Then it vanished. No epidemic of it has ever appeared again. That's the version the textbooks give you. It isn't quite right. The disease didn't leave. You just lost the ability to see it. Start with the wards. Through the 1920s, hospitals across Europe and America filled with them. They sat where they were placed, silent, faces slack, eyes sometimes rolling upward, and locking there for an entire afternoon. Nurses fed them. Years passed. Everyone assumed they were gone. They weren't. Many were listening to every word, watching the decades go by from behind a face that would not answer. The disease had a name. In 1917, a neurologist in Vienna named Konstantin von Economo described it for the first time. Patients falling asleep mid-meal, mid-sentence, some slept for weeks. He called it encephalitis lethargica, the brain inflammation that makes you sleep. Over the following decade, more than 1 million people caught it, and at least 500,000 died. Then around 1930, it stopped. No new outbreaks? No pathogen was ever identified. Nobody has ever proven what caused it. So what was it? For most of a century, the suspect was obvious. The epidemic ran alongside the 1918 influenza pandemic. Same years, same countries, overlapping victims. Case closed. Then in 2001, a research team went into the archives, took preserved brain tissue from people who had died of the disease, and tested it for influenza's genetic signature. They found none, not in one sample. The researchers were careful about what that proved. Either influenza wasn't the cause, or it had hit and run, long gone from the brain before the patient died. Either way, the evidence everyone had assumed for 80 years simply wasn't there. Meanwhile, the statues were still out there. In 1969, in a Bronx hospital, a neurologist named Oliver Sacks gave l-dopa, a drug that restores dopamine, to patients who had been frozen since the 1920s. People who hadn't spoken in 40 years sat up and asked what year it was. Then, for most of them, it wore off. Medicine could briefly undo the damage. It still couldn't say what had done it. But here's where it gets stranger. What if it never stopped? Cases have kept surfacing ever since, one patient here, another there, matching the 1917 descriptions almost exactly. In 2004, a neurologist named Russell Dale gathered 20 of them and tested their blood. 95% carried antibodies attacking the basal ganglia, the deep brain structures that run movement and arousal. Read that again. Not a virus eating the brain. Their own immune systems were doing it, and what set it off was almost boringly ordinary. Just over half of Dale's patients had had a sore throat first. 2/3 carried the blood marker for a recent strep infection. The mechanism is mistaken identity. An infection arrives, and your immune system studies its surface and builds weapons shaped to fit it. But if that shape resembles the surface of your own neurons closely enough, the weapons don't stand down when the infection clears. They go looking, and they find you. So is that the answer? Not yet. In 2024, 2 groups of researchers examined that exact question and came back with opposite conclusions. One team, led by Jonathan Rogers in London, pulled 614 real case files from a hospital archive spanning 1918 to 1946 and tested them against the modern criteria for autoimmune encephalitis. 45% might qualify. Might. A second review that same year went through the very same evidence and concluded the autoimmune case was sparse and not convincing at all. 107 years in, the argument is still live. But buried in that archive study is the finding that should stay with you. The team also took the standard diagnostic checklist for encephalitis lethargica, the one a doctor would reach for today, and ran it against those 614 confirmed historical patients. It caught 28.5% of them, fewer than 3 in 10. Do you see what that means? If the epidemic of 1917 walked into a modern hospital today, the definition built to recognize it would miss roughly 7 patients out of every 10. So how do you lose a disease? You don't. You lose the ability to name it. Every one of those missed patients would be admitted today under something else. An encephalitis, a movement disorder, a psychiatric episode of unclear origin. The file closes and nobody counts it, and the machinery behind it was never exotic. It's the standard equipment running inside you right now, the same system that cleared your last sore throat. 100 years ago, a disease swept the world and left thousands of people frozen where they sat. And then it vanished. And the textbooks are still telling you it's gone. It isn't. It's wearing your own immune system under a different name. So the next time a fever moves through you and quietly passes, remember Vienna in 1917, where the dangerous part was never the infection you caught. It was what your body decided to do about it afterward.